So today we're going to demonstrate placing a PPD in Ms. Sheet's arm here. So she's presented to the office. We have the doctor's order, we've verified it, and we've collected our supplies. And what we have for supplies is a barrier, gloves, a tuberculin syringe, which is a 1 ml 27 gauge half-inch syringe. We have our Tubersol, which is tuberculin protein, purified protein derivative, 0.1 mLs per 5 tuberculin units. We have alcohol and we have a skin marker. Okay, so before we start, we're going to verify that we have the correct patient by asking the name and the date of birth. Then we are going to ask Ms. Sheets if she has any allergies, because we would not give this medication if she was allergic to tuberculin purified protein derivative. And she does not. The next thing that we need to ask Ms. Sheets is if she has anything that depresses her immune system, like cancer or AIDS, or if she's having chemotherapy. And she is not, so it is safe to go ahead and give her this injection. So we can identify our site, borrow her arm here. We're going to do it on the inside of her arm. We are not going to place it over any vascular, so right here would be a very nice spot. It's smooth, it's warm, it's dry, and it's intact. And we're going to go ahead and clean that area using an alcohol pad, working in a circular motion out. The next thing we're going to do is we're going to open our purified protein derivative. We're going to clean the top of that. And while that's drying, if we've just opened it, we're going to go ahead and mark it with the date and our initials. And we'll wait for these things to dry. As soon as they are dry, we can go ahead and draw up our Tubersol. We are going to draw back 0.1 mLs of air and instill that into our vial. We're going to assure that we have the correct dose, which is 0.1 mLs of Tubersol. Then we are sure that our area is dry here, and we are going to go ahead and secure or anchor the skin. Adjust the safety lock so that we can see the bevel of the needle, so bevel up. And then we're going to go ahead and enter at a 10 to 15 degree angle into the skin. And then we will slowly inject this medication creating a small wheel here. Safety lock our needle. And then we will go ahead and place some dots around our injection area. And then the next thing we're going to do, we're going to talk to Ms. Sheets about how she should care for this area, which is no soap and water to the area, no lotion, no scratching, no nothing. Okay, to leave the area be, and then to come back in 48 to 72 hours. So if today is Monday, she'll come back on Wednesday and have this area looked at to find out if she has a positive reaction or not. We will wait for 15 minutes if this is the first time that she's had this injection to ensure that she does not have any negative reactions or allergies to this injection. And after the 15 minutes is up, we will go ahead and dismiss her from the office and let her go on her way.
Okay.